What is a concentrator? It is a machine that literally squeezes oxygen out of air and provides it to you. Normal concentration of oxygen in room air is 21%. And this is what the concentrator takes out and then provides to you in a relatively pure form of oxygen. Now, when we use oxygen outside of a hospital setting, at home, or as we discussed in a RWA designated area, the oxygen can be delivered by nasal cannula or by a mask, face mask. Now, typically we would start with a nasal cannula, which is a simple tubing, and the tubing has 2 ports which are placed inside your nostril. After placing them in your nostril, then on either side the tube hooks around your ears, and then you can tighten it so that it is secure. The tube is then connected to the oxygen tube that comes from the oxygen concentrator. So it attaches to the oxygen concentrator, then you set it to the level required. It can be 2 liters or 3 liters. Alternatively, if it's an oxygen cylinder, it's the same mechanism and you connect it to the oxygen cylinder. While you're doing this, it's important to monitor with the pulse oximeter what the patient's oxygen levels are. So the oxygen level less than 94 is the indication for oxygen, and once you have given the person oxygen, we expect it to go above 94%. The next question is, how do we use an oxygen concentrator? It is a very simple thing to use. It works on electricity, so it has to be connected and it has to be pressed on. Now, humidification, which is a common thing we use, is provided by filling the bottle with distilled water and connecting it. The tube dips into it and we can see the oxygen bubbling when we set the rate at 1, 2, 3 or 4 liter. Most concentrators give oxygen up to 5 liters per minute, but we do have high flow ones which give up to 10 liters per minute. There is also a device called an oxidizer which can increase this oxygen rate, flow rate. It concentrates the oxygen even further and gives a more purer form of oxygen, and this is just one of the devices that can be used with the concentrator. Once the humidifier has been attached, then once again the oxygen tube is attached to the humidifier port, and that tubing is further connected to the nasal prongs that the patient is using. We set it at the right level, we check the patient's oxygen saturation with the pulse oximeter. So this is the way one can use the setup at home, but again the key thing to remember in the circumstance, in the situation of COVID-19 infection, is that if your levels are low, oxygen level less than 94% or respiratory rate more than 24, or a subjective feeling of breathlessness, you must seek medical attention immediately. Thank you very much.